Thank you very much for the opportunity to participate. I'll try and make this short and to the point. AFP has had journalists focusing on misinformation since 2017. So we have been following the coronavirus infodemic right from the very beginning, when dubious posts first began appearing on social networks in Asia in January. Our worldwide network includes 76 journalists in 32 countries, publishing fact checks in 12 languages on our dedicated verification hub. There are several things that we have noticed about this particular infodemic. One of the most striking things is the sheer scale of the public thirst for verified information. Traffic to our websites has absolutely skyrocketed from mid-February, as you can see over here. As you can see from this chart. To give you an idea of the scale of just how big the demand is, take a look at this. In the first 3 months of this year, which is these two left-hand columns, we have had more traffic, more visitors and page views to our web pages than for the entire period of 2019. And most of this has come in February and March. So people really want to know, they want trustworthy information on this. Aside from that, the scale, we have, there are several trends that we have found that are particular to this specific story. Let me just take you to our hub just to give you an idea of this. Okay, number one, a lot of the advice about cures and treatments are not being shared out of malice, but as you know, they can be harmful and life-threatening. So some of the examples, we have had videos, for example, viewed millions of times in the Philippines that claim that the virus can be cured with an eye drop made of sap from a local shrub. We have had a video of a doctor advising people to steam disposable surgical masks. We have had videos on a homemade recipe to make hand sanitizer by mixing rum, bleach, and fabric softener. We have had a wrong hotline number shared in Canada, for example. And again, a lot of these are not being shared out of malice, but are being shared by people who want to help. They want to help, but they're just sharing wrong information out there. Number two that we have noticed is imposter content, by which I mean content that imitates media or health organization or official websites. And they have been very effective in this crisis in propagating rumors and sowing confusion. For example, we have had several posts claiming official advisories from everyone, including the Singapore Health Authority, the UK hospitals, UNICEF, and including the World Health Organization. Much of the information contained in these posts has run completely contrary to health experts' advice. We've also had, for example, a video of US President Donald Trump and a top US pharmaceutical executive speaking at a press conference, and in theory announcing distribution of a vaccine for the virus. Neither man has said anything about a vaccine. Number three that we have noticed is that the same disinformation is being recycled in different regions. And this is where our experience in the fact that we have covered this from right from the beginning comes in very useful. So for example, one of the top ones that we've noticed is advice from health experts or doctors recommending various prevention measures. And these have popped up all over the globe and usually include anything from drinking water, rinsing your throat, consuming garlic or ginger in various forms, holding your breath to see if you have the coronavirus, going out into the sun to kill it. We've also had the same photos. So for example, right in the beginning of the outbreak, we had a photo from an art project in Germany to commemorate concentration camp victims that was presented as victims of coronavirus lying on the ground in China. And then a few weeks ago, or about a week ago, we had the same photo creep up in posts claiming to show victims lying on the ground in Italy. And we've had, for example, coffins of refugees who died in the Mediterranean, I think it was a year ago, and these have popped up in various posts all over the globe as well, claiming to show victims of the coronavirus. Number four trend that we've noticed is that lots of rumors are in local and closed spaces such as Telegram, Nextdoor, and WhatsApp. And for example, on WhatsApp, there was one message that was circulating that recommended taking a dangerously high dose of the anti-malaria drug chloroquine, which I'm sure you all have heard of. Now, while some of the information is harmless, so for example, a few days ago, we had misinformation on an orangutan washing his hands after having learned the procedure from a handler, which was false. But some of it can be not only very dangerous, disruptive, but also deadly. So we have had people in the UK who have tried to take down 5G towers. We have had people in the US who have fallen ill after drinking bleach or taking the anti-malaria medication. And we have had people in Iran dying after drinking bootleg alcohol after reading that this prevents or treats the virus. Now, some of the things that we're doing differently for this, to meet this challenge. We have stepped up our collaborative projects to share information and increase the impact of our work or of our fact checks. This has included the Trusted News Initiative, which is a shared alert system with other media organizations. We have also, and this is critical, we have stepped up our collaboration with the tech companies like Facebook, Google, and Twitter. And this I have to underline, this is key to fighting disinformation because these are the platforms where the misinformation is being shared and spread at an alarming speed. So you really need to work with these companies to disseminate fact checks and trustworthy information. We're also working with fact checkers worldwide on the Coronavirus Facts Alliance, which is led by the International Fact Checking Network. And finally, I mean, given the scale of the infodemic and the massive public demand for trustworthy information, we really need to increase fact-checking efforts and partnerships between us and tech companies, journalists, and health experts, so we can get expert advice on the misinformation being shared as quickly as possible.